Good morning. I'm Julia Wacker, President of the North Carolina Healthcare Foundation. Yesterday, Dr. Wells announced a new resolution on behalf of NCHA and its 135 members to address racial disparities in care delivery, marking something significant for our state. The Equity of Care Resolution is the first of its kind for North Carolina's hospitals, health systems, and care providers, and will guide us all in the same direction to close gaps in care across the state. The initial quality improvement measures we will work on together, as outlined in the resolution, are just a start. NCHA will work with our membership and other partners to develop an Equity of Care scorecard, and as our hospitals and health systems close racial disparities in care delivery, we will add to the scorecard over time. This initiative beautifully integrates with all that have been doing to improve quality, patient safety, and the patient experience. We have a long path ahead, but North Carolina's hospitals and health systems should be proud to lead the nation in taking this initial step. Resolving to act to close the disparity on specific quality improvement measures is one yet significant part of NCHA's commitment on behalf of its members to addressing equity. A related critical component is building a pipeline of hospital and health system leaders who reflect the patients and the communities they serve. There is a known direct correlation between health inequities and the underrepresentation of minorities that we see in our hospitals and health system leadership across the country. The most recent study by the American Hospital Association's Institute for Diversity and Health Equity highlighted that only 14% of hospital board members and 9% of CEOs are minorities, percentages that have not budged in a decade. Because of this, in 2019, our foundation board chair, Phyllis Wingate, challenged us to start the Diverse Leaders Mentorship Program. We are proud to have recently welcomed our third class of mentees, 16 remarkable women and men from 8 hospitals and health systems across the state, and paired them with one of our 9 mentors for a year-long mentorship program.
I actually grew up in a small Hispanic community in Texas, and our community was mostly Hispanic, low income, mostly Spanish speaking only. And I have this memory where we were going to a little community clinic and it was just crowded, line out the door. It was like the only Hispanic, Spanish speaking doctor that was around. And it was just not an ideal situation, very uninsured population. And I remember thinking, someone should do something about this. And I think that planted the seed, and from there everything I've been wanting to ever do was around healthcare. The biggest draw was, NCHA is already a really good organization, and the fact that they're encouraging diversity and their whole focus is on connecting us with mentors, but the ultimate goal is to help us professionally grow and develop and help our careers along. I thought that was a great cause, and it's really not something that you can get from anywhere else in that focus, so it's just a really good opportunity. Obviously, the professional knowledge, industry knowledge, and the connections are great, but I think I'm already in this program getting so much exposure to people and professionals and other organizations that I really would have had no way of connecting with before that. So I think not only is it kind of broadening kind of my world and exposing me to new things, but you never know who you're going to meet and kind of where that's going to help take you.
Today, we celebrate the Diverse Leaders Mentorship Program and the impact it has made, but know we can do so much more, and so much more needs to be done. We want to do our part in reshaping the future of North Carolina's healthcare workforce to be one that is equitable, empowered, and equipped to provide the best care for every patient that comes through our hospital doors. Join us as a mentor, a mentee, or a supporter by giving a gift to help with the expansion and the sustainability of the program. Sign the Equity of Care Resolution and be part of a statewide movement to realize a more equitable future of healthcare for North Carolina. Now, I'm pleased to welcome Dr. Frida Lewis Hall. During her 35-year career in medicine, Dr. Lewis Hall has been on the front lines of healthcare as a clinician, researcher, and leader in the biopharmaceuticals and life sciences industries. A graduate of Johns Hopkins University and Howard University School of Medicine, she serves on numerous boards, including the Harvard Medical School, the Dell Medical School, and the Foundation for the National Institutes of Health. Welcome, Dr. Lewis Hall.